Foundations of U.S. Healthcare Delivery by Professor Tammy. Foundations of U.S. Care Delivery, Part 3.
Healthy People Initiatives. So Healthy People Initiatives have 10-year plans. So every 10 years, Healthy People Initiatives give a 10-year plan in the United States. Why do they do that? Well, what happened 50 years ago, then our health needs is very different from our health needs today. And our health needs today is different from something that was 10 years ago or even 20 or 30 years ago. So right now we are in Healthy People 2020, which started on January 1st, 2020 and ends on December 31st, 2029. Do you see the years, or do you hear the years? 2020 through 2029, from the first day of 2020 to the last day of 2029. So guess when Healthy People 2030 starts and ends? So when you think about it, it'll be January 1st, 2030 through December 31st, 2039. That will be what Healthy People 2030 will be. Because in the future, the health needs will probably be different from what it is right now. Key national health objectives. These are the major health issues we have in the United States, and we need to focus on, or what they think is important, and we need to focus on improving our health situation needs based on the key national health objectives, because the health objectives changes as we move on. So the Healthy People Initiatives was founded on the integration of healthcare and prevention, health promotion, and education. It has 3 goals. The Healthy People Initiatives goals are collaboration, empowerment, and measurement. So Healthy People 2020 goals is attaining high quality, longer lives free of preventable disease, injury, and premature death. It's achieving high equity, eliminating disparities, and improving the health of all groups, creating social and physical environments that promote good health for all, promoting quality of life, healthy development, and health behaviors across all life stages. So all different age groups, like life stages would be infant, child, teen, adults, and elderly. So I want you to also read page 37, table 2.2, evolution of Healthy People Initiatives. Read how the healthy people changed over time. So these are the major issues that are happening now. Let's just say that in the past, there was Healthy People 1770, and in the future, there's Healthy People 5000. Would the goals be the same as the present one? No, it would be totally different from Healthy People 2030 or 2020, because our health issues will be different. Our health issues are different from 1700, 1770. Back then, they didn't really have a, good sanitation. Now ours is so much better. And Healthy People 5000 in the future, their goals will be completely different. Hopefully we overcome a lot of the stuff that we have today. So Healthy People 2020, there are 4 fundamental health measures. General health status, quality of life and well-being, determinants of health, disparities among the population. So I want you to look at implementation and progress on page 39 and review figure 2.3, action model to achieve Healthy People 2020 overarching goals. So again, when will Healthy People 2030 start? So think about 2030. So it'll start January 1st, 2030, and it ends at the end of the decade, December 31st, which is the last day of that decade, 2039. Public health. Focus on improving population health and well-being. So they focus on determinants, also known as factors, determinants or factors, to improve the nation's health and resolve disparities among its vulnerable populations. A framework embodying the social and medical determinants if warranted. Focusing on determinants. You can also find this chart in your book. Figure 2.4, social determinants of health. So let's look at social determinants. And it's divided into two. SES behavior and demographic inequality. So you're like wondering, what does SES stand for? It means socio-economic status. SES. And it usually deals with social and public policy programs. And when you think of social and public policy programs, who are usually their target group? Who are the people they usually help? It's usually determined by income, education, and the employment of that person. And another SES behavior is behavioral change. Okay, let's look at the demographic inequality. Community and nonprofit initiatives. So you have these initiatives to help certain demographic groups. And also vulnerable population is also considered as part of a demographic inequality group. Remember, it could deal with someone with chronic diseases, age, or even income status too. So when you put them together, this all deals with a person's health and well-being, which also deals with the different dimension of their health, which is physical, mental, and social, and spiritual. So let's look at the bottom. Here it says healthcare delivery is the continuum of health. That means like continuation, keeps going. And there's a couple of them. There's like 7. Public health, preventive health, primary health, specialty care, mental health, chronic care, and long-term health. When you kind of break them down and then point them up, what do these deal with? What do these continuum of care deal with? They deal with insurance, distribution of health care, the type of quality health care, cultural, linguistic. When you go to health care, a healthcare worker can say, oh, I speak Spanish. But one person's Spanish could be different from another because maybe the Spanish they speak is from a different region, and culture could be different as well too. So even though they may speak the same language, but the cultural understanding is not 100%, depending on the region where these people are from too when they're speaking to you, and vice versa. Alternative medicine, technology balance. Some places, like especially cities, have more high-tech technology versus a rural area. Service provider integration, safety net providers, consumer participation, and community partnership. And all these also contributes to the person's health and well-being, their overall dimension of health: physical, mental, social, and spiritual. Social determinant of health. Social determinants of health definition. You can click on this hyperlink to view, and this can also help you with your research project by determining what group you want to focus on. So the social determinants of health framework includes demographics, personal behavior, and community level inequalities and their defining influences on health. There's also personal demographics such as race, ethnicity, age. These directly contribute to vulnerability levels. Social and income inequalities have been shown to contribute to disparities in health, especially if you don't have the money or you sometimes might get treated differently, depending where you go, too.
See you soon. And remember to read the book.